Hello and welcome to the American Academy of Optometry Foundation podcast series. And today I'm joined by Dr. Stephanie Martich, where we're going to be talking about herpes zoster ophthalmicus recurrence after recombinant zoster vaccination. So Dr. Martich, welcome to the podcast. And if you could just give the audience a little bit of a background on yourself.
Sure. My name's Stephanie Martich, and I am an assistant professor in the Department of Ophthalmology at the University of Colorado School of Medicine. I've been here for a couple years now, and I work primarily in the primary care area, but I really enjoy ocular disease, and that is what I got my residency in at the Eye Center of Texas.
That's great. And I'm Dr. Mila Brujic. I'll be hosting this episode. And let's kind of jump right into it because this is a really interesting topic. So why do you really think that this topic is important to us as optometry? And if you could even give us a little bit of a background on the paper, that'd be great.
Sure. So this is really important to optometrists just because the incidence of herpes zoster shingles across the US and throughout the world has been steadily rising. And so the number of patients affected by the eye condition, herpes zoster ophthalmicus, is also increasing. So the number of ODs that will encounter this in their clinical practice is great. And the study is really relevant in how we will educate our patients regarding the recombinant zoster vaccine after their episode of herpes zoster ophthalmicus. So this is a retrospective cohort study, and it just looked at the incidence of herpes zoster ophthalmicus in patients after they received the zoster vaccine. So it compared a group of individuals that had herpes zoster ophthalmicus that then went on to become vaccinated, and then their recurrence rate compared to those that did not receive the vaccine.
Yeah, that was interesting. I mean, some of these things we don't necessarily think about because we're so on the front lines treating it. But let's take a little bit of a step back, Stephanie. So describe to us herpes zoster ophthalmicus and how it's treated and what the risks of recurrence actually are in this.
Mm-hmm. Yeah. So herpes zoster ophthalmicus occurs when the varicella zoster virus affects the trigeminal branch or the trigeminal nerve, the ophthalmic branch of it. And it occurs in about 10 to 25% of cases of shingles. It can affect nearly any part of the eye, the front of the eye, the back of the eye, from keratitis to posterior uveitis. And depending on the area of the eye that is affected, treatments may differ, but a mainstay of treatment is oral antiviral medications like valacyclovir and acyclovir. Supportive treatments like artificial tears and analgesics can be used often. But if not treated early, or if there are recurrences of this condition, it can lead to very vision-threatening conditions like corneal scarring, secondary glaucoma, retinal detachments in the case of posterior uveitis, acute retinal necrosis, things like that.
Yeah, we sometimes think about it as these kind of benign type eyelid lesion things, and we have to keep in mind that there are more serious consequences for certain patients.
Mm-hmm.
So what's the current, I guess, recommendations understanding what this paper has shown for vaccination, and how does this study change how we maybe recommend vaccination for our patients?
Mm-hmm. So the current recommendation from the CDC is that adults that are immunocompetent and 50 years or older receive this vaccine, 2 doses about 2 to 6 months apart. And then immunocompromised adults that are 19 years or older receive this vaccine about 1 to 2 months apart in those 2 doses. It's shown to be up to 90% effective in preventing herpes zoster. But this study showed that individuals that have had herpes zoster ophthalmicus that receive this recombinant zoster vaccine, their incidence was about 37.7 per 1,000 that had a recurrence of herpes zoster ophthalmicus, compared to individuals that had a history of this eye condition that didn't receive the vaccine. It was about 26.2 per 1,000 that had an episode of recurrence. So it just shows us that, if your patient has had herpes zoster ophthalmicus, they may want to refrain from getting this zoster vaccination, as it certainly increases the risk of recurrence.
So Stephanie, you're obviously well versed in this area and this topic. What's the etiology of the varicella zoster virus reactivation in patients with herpes zoster ophthalmicus?
Mm. So the etiology is not entirely clear, but it is thought that is a reactivation of herpes zoster ophthalmicus. It's an immune response to some components of the vaccine because the vaccine doesn't actually include live virus. But there was one study that showed that viral DNA is actually still present in the cornea of individuals with herpes zoster ophthalmicus during periods of latency. So they may be especially susceptible to recurrence if they get this vaccine.
And is there anything else? I mean, this data was pretty interesting and it caught me a little bit off guard when I read the paper because you always wonder with things like this, but when you actually see it and it's proven, it's there, you do have a little bit of an increased risk if you have had a previous herpes zoster ophthalmicus and you do get the vaccination. Is there anything else that we need to be thinking about or considering for these individuals, or anything that you'd like to add about this topic?
Definitely. I think one thing to think about is just that some patients are on long-term low-dose systemic antivirals. So think of your patients with, say, HSV keratitis or patients that are HIV positive, they may be on low-dose antivirals. And so their risk of recurrence may be a little bit lower than the general population that is affected by herpes zoster ophthalmicus. So that may sway their decision in getting this recombinant zoster vaccine, especially if they're on this low dose antiviral, being an immunocompromised individual.
Well, Dr. Martich, thank you so much. This was really, really insightful. Appreciate all the insights that you've kind of added on this topic and just being able to really, in a concise way, simplify the data for us clinically. Appreciate you being on this episode.
Thanks for having me.
And thank you all for joining us on this episode of the American Academy of Optometry Foundation podcast series.